Yeah. Good morning, everyone. My name is Brian Dixon. I'm an associate professor in the Department of Epidemiology at the Richard M. Fairbanks School of Public Health at Indiana University and a research scientist at the Regan Street Institute. And I'm delighted to talk with you this morning for just 5 minutes about our new training program in public and population health informatics that was funded this summer by the National Institutes of Health at the National Library of Medicine. Here's a QR code if you want to get out your phones or take a picture and scan it later. That will take you to the website where we have information about our training program. So our project was funded. Thank you to the NLM. I know I saw Lisa Lang somewhere right in front of me. So we are just ecstatic. We, in our proposal, we argued that historically the NLM has funded a lot of really good training programs that have focused on things like clinical informatics and really created the leaders who are pushing the new board certification in clinical informatics and also translational informatics and other areas. But over the years, we observed that there weren't a whole lot of people who were specializing in public and population health informatics as part of that program. And so our program is specifically focused in that area. It's a 5-year, $2.5 million grant, and it funds and covers, those funds are used 100% to support pre-doctoral or doctoral students and postdoctoral fellows. And the goal is to produce the future faculty and leaders in our field. So I am just delighted we have our, I'm going to embarrass them now, but we have our trainees, our first cohort here at the conference and at the workshop with us. So I invite, raise your hands, guys. Please go and introduce yourself to these amazing young folks who are just very bright, talented, and eager to work on projects. So Marianne, you don't have any evidence to show impact today. Go talk to Carmen. Carmen will study the heck out of the eHealth Exchange and provide a whole body of evidence for you. She's working with Sheep, by the way. But those are exactly the kinds of folks and connections that we want to make. Our curriculum is, as I mentioned, uniquely focused on public and population health informatics. So we think of our curriculum, the core foundations of it are based in epidemiology and health policy and management. And then on top of that, we were building in a minor. So our university is unique. It requires all doctoral students to complete a minor that is outside of their major. So they have to take a series of at least four courses in the minor area. And so our minor is in population health analytics. So with a good foundation in public health, on top of that informatics courses and a focus on analytics, we hope that that will produce the skills and training necessary for individuals to then go work at CDC, at state health departments, at local health departments, at ACOs, at other organizations that are trying to do not only population health analytics, but really support the spectrum of public and population health informatics. During their training, in addition to their coursework, our fellows are getting applied research training with the faculty and mentors, not only at the Regan Street Institute, which is where their primary mentors are based, but also out in the community with our partners. We have a fantastic partnership at the Marion County Public Health Department and at the State Health Department. And so they're going to be working in health departments as part of their training, and also with our hospital partners and ACOs and our health information exchange that Regan Street helped build and create. And so we want that community linkage to be a part of our program. And then we really see this new training program that we have as building upon and extending Regan Street's vast legacy in health information exchange, standards, EHR-based work, clinical decision support, electronic laboratory reporting and surveillance, which we have done in the past, but we're now pushing it into this new area. So we're extremely excited about not only sort of launching this curricular program, but also having our first cohort of students. And by the way, for those who are interested, we're also now recruiting for next year's pre-doctoral and postdoctoral fellows. So if you have any students that are finishing their bachelor's program or their master's program or finishing their doctorate and they want to go and do training like this, please send them my way. I'm happy to talk to them at the conference, or they can drop by the Regan Street booth. So let me give you some example projects of some things that our students will be doing, but we envision, for example, building dashboards that allow providers to monitor opioid usage in a population. We have a project that's building that now, analysis of HIE usage and its impact on emergency department outcomes as well as costs, examining the rate and factors associated with syphilis testing in women with a stillbirth delivery, and then machine learning models to automate notifiable disease reporting as well as surveillance. So this runs the gamut of projects and gives you a sample of some of the things that our students will be doing over the next few years. Again, I want to thank you for your time and attention and for coming today to the workshop. Thank you.
That was a lot for 5 minutes. We are going for the break right now. Again, those tables, Ashish will talk about the book. I'm also available.